What we see so far is that the lens is very rotational stable, comparable to the Comfort model that is a 4-point fixation. Even this one only has a C-loop. The patients are extremely happy. The optical quality is very good and the lens also centers itself really well, so the near segment works efficiently.
The Acunex material has put out a claim on the no gliss material. Now, in order to prove this, we have examined these lenses under clinical conditions, taking standardized photographs and looking for glistenings within the IOL body and the IOL material. By testing the Acunex clinically, several factors are important when changing to a new lens or new lens material. These factors do include refractive stability and predictability, meaning does the lens undergo major changes once implanted in the eye, and do we see changes of refraction in the early postoperative period. Once implanted in the back, the lens remains in a stable position, which is very important by considering this a platform lens, also prone for future or already existing future designs, meaning multifocality, toricity, and other optical features that are always wanted to be placed on a new platform design like the Acunex.
So we conducted the first-in-man study of the Acunex Vario extended depth of focus IOL. We implanted 20 patients bilaterally with the Acunex Vario lens, and we checked the patients for visual outcomes as well as visual disturbances and refractive outcomes. So in terms of visual outcomes, all of the patients manifested with excellent distance and intermediate visual acuity, and surprisingly, for an extended depth of focus lens with only 1.5 diopters adds, the patients also had excellent near visual acuity. In terms of refractive outcomes, our patients got very good refractive outcomes, especially when we adjusted for the A constant. The patients had very good uncorrected distance visual acuity and intermediate visual acuity as well. In terms of visual disturbances, we did not have any patient complain of visual dysphotopsias, both positive and negative. And when we questioned the patients directly, specifically for glare, halos, and such visual disturbances, the patients generally were very happy with the results. So in general, when we asked the patients how satisfied they were with their vision, they reported excellent distance and intermediate visual acuity, as well as reading ability. And when we plotted the defocus curves, the Acunex Vario lens demonstrated the expected extended depth of focus curve, giving us continuous vision at different distances. So in general, we were very happy with the results, and I'm sure the patients will be very happy with this lens.
The results have shown that within the first week, we are getting defocus curves which are very similar to the defocus curves that we were getting with the hydrophilic version of this lens, and hence we are very confident in its ability to work. The vision improves very quickly, and we're seeing defocus curves in keeping with the low-ad segmental bifocal within the first week of analysis.
When we plotted the defocus curves, the Acunex Vario lens demonstrated the expected extended depth of focus curve, giving us continuous vision at different distances. So in general, we were very happy with the results, and I'm sure the patients will be very happy with this lens.